When people think about robotic-assisted surgery, they think a robot operating autonomously, but that's not the case in orthopedic surgery. Instead, think of the robotic-assisted portion of the surgery as a tool that I use to help assist me make accurate cuts, assess the balance of your joint, and accurately restore your anatomy to give you the most optimal joint replacement. While there are several benefits to robotic-assisted surgery, I think some of the important ones for the first time really ever in joint replacement surgery, it allows a surgeon to reproducibly, within 1 degree and 1 millimeter, execute a plan. And so what that allows us to do is perform a joint replacement surgery that is very custom to the patient. So we're now able to reliably do a procedure that restores that patient's anatomy. We all have different hips, we all have different knees, and each hip and each knee requires something different. What robotics allows us to do is think very critically about what each patient needs, and then go execute that plan with a high amount of precision.